Tonight, I wanted to talk about the fundamental and life-saving role that diet and lifestyle can play in helping us to achieve A, optimal health, B, to prevent chronic disease, and C, to reverse diseases that are already established. Many of us may have heard the saying that prevention is better than cure, or an apple a day will keep the doctor away. But how do we go about it? It can be hard to distinguish between reliable and useful sources of information that is that are scientifically sound and the latest fads to do with diet and lifestyles. Not to mention the impact of the huge advertising budgets that mega corporations like McDonald's, for example, have. As a special treat, many millions of parents tell their children if they do their homework well, they will, as a treat, they will take them to a fast food restaurant or an entertainment complex without really paying adequate attention to the dangerous side effects, or without analyzing the short or long-term effects and the dangers of the products being consumed. We can all help educate ourselves and be more proactive in looking after our own health. The information overload in society doesn't make the task any easier, but we have to try. If anyone is interested, they can look up educational documentary programs such as Super Size Me on YouTube by Morgan Spurlock. Really interesting. This talk is based on a summary of the facts in Dr. Greger's book, How Not to Die. In the 5th century BC, Hippocrates, who is considered as the father of medicine, said, "He who doesn't know food, how can he understand the diseases of man?" As the saying goes, you are what you eat. 2,500 years ago, Hippocrates was aware of the importance of the relationship between what we eat and how it affects our health and well-being. The Hippocratic oath that doctors take means doctors will do whatever they can to help their patients. But we can also play a crucial role by choosing healthy lifestyles, diets, and habits. Dr. Michael Greger has written an international bestseller called How Not to Die. In his book, Dr. Greger cites research to help us discover the foods that have been scientifically proven to prevent and even reverse disease. Dr. Greger divides the book into 15 chapters, with each chapter dedicated to a chronic condition that affects millions of people. Chapter 1 is How Not to Die from Heart Disease. Chapter 2 concerns lung disease. Chapter 3 concerns brain disease. Chapter 4, digestive cancers. Chapter 5, infections, how not to die. Chapter 6 concerns diabetes. Chapter 7 concerns high blood pressure. Chapter 8 concerns liver disease. Chapter 9 concerns blood cancers. Chapter 10 concerns kidney disease. Chapter 11 concerns breast cancer. Chapter 12 concerns suicidal depression. Chapter 13 prostate cancer, chapter 14, Parkinson's disease, and chapter 15, iatrogenic causes, which relates to illnesses caused by medical examination or treatment. For example, medications that we take may have side effects which can lead to iatrogenic diseases. Dr. Greger is also the founder of nutritionfacts.org website. In his book, Dr. Greger also introduces Greger's Daily Dozen. These are the foods to eat to add years to your life. Dr. Greger says his interest in medicine started when he was a child. He says doctors had sent his grandmother home in a wheelchair, basically to die. She had been diagnosed with advanced heart disease. She had had so many bypass operations that the surgeons had essentially run out of options. The scar from each open heart surgery had made the next one more difficult than the next one more difficult until the surgeon, the doctors had run out of options. She was confined to a wheelchair with crushing chest pain. The doctors had told her there was nothing else they could do for her. Basically, the experts were telling her her life was over at age 65. Dr. Greger says what motivates many young people to go into medicine is watching a loved one become ill or even die. But for him, it was watching his grandmother get better. Dr. Nathan Pritikin was an early lifestyle medicine pioneer who had been gaining a reputation for reversing terminal heart disease. Dr. Greger says his grandmother made the long journey to California to be one of Dr. Pritikin's first patients in the newly opened clinic. This was a living program where everyone was put on a plant-based diet and then started on a graded exercise regimen. Dr. Pritikin says when Frances Greger arrived at our clinic, she was in a wheelchair and suffering from advanced heart disease, angina, and other cardiac complications. Her condition was so bad that she could no longer walk without great pain in her chest and legs. Dr. Pritikin adds further that within 3 weeks, not only she was out of the wheelchair, but she was walking 10 miles a day. Dr. Greger says what mattered to him at the time was that he got to play with his grandmother once again. He says at the time, the medical profession didn't even believe it was possible to reverse heart disease. Basically, drugs were given to slow the progression, and surgery was performed to relieve the symptoms of heart disease. But the disease was widely expected to get worse and worse until the patient died. Dr. Greger says, now we know as soon as we stop eating an artery clogging diet, our bodies can start healing themselves. In many cases, opening up arteries without the need for drugs or surgery. He says his grandmother was given a medical death sentence at 65. Thanks to a healthy diet and lifestyle, she was able to live another 31 years on this earth until she was 96 years old. Dr. Greger says his grandmother's near miraculous recovery inspired him to pursue a career in medicine, and she lived long enough to see him graduate from medical school. One of the pioneering giants on the role of healthy nutrition and lifestyles and diets and disease was Dr. Dean Ornish. Dr. Dean Ornish also founded the not-for-profit Preventive Medicine Research Institute. Dr. Dean Ornish proved beyond a shadow of doubt what Dr. Nathan Pritikin had proved earlier. Dr. Pritikin had gained a reputation for reversing terminal heart disease simply by putting patients on a plant-based diet and a graded exercise regimen. Using high-tech advances such as cardiac PET scan, positron emission tomography, which is a specialist imaging scan that uses radio tracers to assess organ and tissue functions. Dr. Dean Ornish and his colleagues had shown that using the lowest tech approach, i.e., diet and lifestyle changes, can undeniably reverse heart disease, which is the leading killer of preventable deaths in the US. Approximately 375,000 people die from heart disease in the US every year. Dr. Dean Ornish and his colleagues' studies and research results were published in some of the most prestigious medical journals in the world. Yet, the reality of medical practice hardly changed, says Dr. Greger. Dr. Greger says this made him wonder what the underlying reasons could be. He realized the depressing fact that there were other forces at work in medicine besides science. The US healthcare system runs on a fee-for-service model in which doctors get paid for the pills and the procedures they prescribe. Basically, the system rewards quantity over quality. Dr. Greger says, we don't get reimbursed by the insurance companies for the time spent advising our patients about the benefits of healthy eating. He says if doctors were instead paid for performance, there would be a financial incentive to treat lifestyle causes of disease. The global turnover of the pharmaceutical giants is more than 500 billion pounds annually. That's 500 with 9 additional zeros. About 1/3 of this turnover is the US market share. Dr. Greger says until the model of reimbursement changes, which is a fundamental change, he doesn't expect great changes in the medical healthcare system or in medical education. He says only a quarter of medical schools appear to offer a single dedicated course or module on nutrition. He says when he went for his first interview at Cornell Medical School, the interviewer, who was a pediatrician, child consultant, emphatically told him nutrition is superfluous to human health. It doesn't matter. Don't worry about it. That's what he was saying, basically. Dr. Greger says he was honored to have been accepted at 19 medical schools to study medicine, and chose Tufts because they offered the most nutrition training, which was a mere 21 hours. This was even the 21 hours, which was the max, which was the most. This was less than 1% of the curriculum. He says during his medical training, he was offered countless steak dinners and fancy perks by the representatives of powerful and large pharmaceutical companies. He says the reason you hear about the latest drugs on TV is because pharmaceutical companies have huge budgets to promote their products. He says the reason you will probably never see a commercial on TV for sweet potatoes is the same reason breakthroughs on the power of foods to affect your health and longevity may never make it to the airways. There basically is little profit motive. That's what they're saying. He says in medical school, there was no mention of using diet to treat chronic disease, let alone to reverse it. He says, if the cure to our number one killer could get lost down the rabbit hole, what else might be buried in the medical literature? He says, with the help of the American Medical Student Association, he made it his mission to speak at every medical school in the country every 2 years to influence an entire generation of doctors. He says he wanted every doctor to have the knowledge of the healing power of foods in their toolbox. He says in clinic, he could reach hundreds of patients, on the road, possibly thousands, but he wanted to reach millions. And he says, with the help of a Canadian philanthropist, Jesse Roche, the website nutritionfacts.org was set up to provide accessible, evidence-based nutrition information to all. There are more than 1,000 bite-sized videos on nearly every conceivable nutrition topic, posting new videos and articles every day. Everything on the website is free for all and all the time. There are no ads or corporate sponsorships either. He says it is a labor of love. Dr. Greger says in the beginning of this work, he was training trainers and educating healthcare professionals, but with the democratization of information, doctors no longer hold a monopoly as gatekeepers of knowledge about your health. He believes by empowering individuals directly and by providing them with simple and scientifically sound lifestyle advice, it can be much more effective in achieving better health for all. As mentioned earlier, the global annual turnover of the pharmaceutical industry is more than 500 billion pounds, with the US accounting for about 1/3 of this market. In the US, high blood pressure affects people around 55 years of age, heart attacks, people around 60 years of age. Dr. Greger says science has shown that for most of the leading causes of death, our genes account for 10 to 20% of the risk factors. The rates of killers like heart disease and cancers differ up to 100-fold among various populations around the globe. When people migrate from low risk to high risk countries, their disease rates almost always changes to those of the new environment, new diet, new diseases. He says, while a 60-year-old American living in San Francisco has about a 5% chance of a heart attack within 5 years, should he move to Japan and start eating and living like a Japanese, his 5-year risk will drop to only 1%. That is an 80% reduction in risk. Japanese Americans in their 40s can have the same heart attack risk as Japanese in their 60s. Switching to an American lifestyle, in effect, aged their hearts by a full 20 years. In terms of life expectancy, the US is 27th or 28th on the list of 34 top free market economies. People in Slovenia live longer than those in the US. Dr. Greger says the extra years the Americans are living now are not necessarily healthy or vibrant. In 2011, a disturbing analysis of mortality and morbidity was published in the Journal of Gerontology, which is the science of the study of old age and related diseases. One of the questions asked was whether Americans were living longer compared to a generation ago. Technically, yes, but were those extra years necessarily healthy ones? No, says Dr. Greger. It was worse than that. They were living fewer healthy years than once they did. So he explains it more. In 1998, a 20-year-old American could expect to live about a further 58 years, while a 20-year-old in 2006 could look forward to living approximately a further 59 years, another one extra year. However, the 20-year-old from the 1990s might live 10 of those years with chronic diseases, whereas the other 20-year-old was more likely to live 13 of those years with heart disease, cancer, diabetes, or stroke. The researchers also noted that the population was living too fewer functional years. That is, for 2 years, they were no longer able to perform basic life activities such as walking a quarter of a mile, standing or sitting for 2 hours without having to lie down, or standing without the need for special equipment. The researchers concluded that they were living longer, but living sicker. A special report published in the prestigious New England Journal of Medicine entitled A Potential Decline in Life Expectancy in the US in the 21st Century concluded that the steady rise in life expectancy observed in the modern era may soon come to an end, and the youth of today may, on average, live less healthy and possibly even shorter lives than their parents. Dr. Greger explained in 1900 in the US, the top 3 killers were infectious diseases like pneumonia, tuberculosis, and diarrheal disease. In contrast, the current killers are lifestyle diseases such as heart disease, cancer, and chronic lung disease. You may ask, is this because antibiotics have enabled us to live long enough to suffer from degenerative disease? Dr. Greger says no. The emergence of these epidemics of chronic disease was accompanied by dramatic shifts in dietary pattern. This is also exemplified by what has been happening to disease rates among the developing world over the last few decades, as they have rapidly westernized their diet. Dr. Greger says in 1990, around the world, most years of healthy life were lost to undernutrition, such as diarrheal diseases in malnourished children. But now the greatest disease burden is attributed to high blood pressure, which is a disease of overnutrition. The epidemics of chronic disease is in part due to near universal shift towards a diet dominated by animal-sourced and processed foods. In other words, more meat, dairy, eggs, oils, fizzy drinks, sugar, and refined grain. China is perhaps the best studied example. The transition away from the country's traditional plant-based diet was accompanied by a sharp rise in diet-related chronic diseases such as obesity, diabetes, cardiovascular diseases, and cancer. The question Dr. Greger asked is, how are scientists able to relate the effects of specific foods to chronic diseases? To isolate the effects of different dietary components, researchers can follow the diets of large groups of targeted individuals over time. Take meat, for example. To see what effects an increase in meat consumption might have on disease rates, researchers studied lapsed vegetarians, people who once ate vegetarian diets but then started to eat meat at least once a week, experienced a 146% increase in odds of cardiovascular diseases, a 152% increase in stroke, a 166% increase in diabetes, and a whopping 231% increase in the odds for weight gain. During the 12 years after the transition from vegetarians to omnivores is when they eat plant-based stuff as well as animal stuff, meat eating was associated with a 3.6-year decrease in life expectancy. Dr. Greger says even vegetarians can suffer high rates of chronic disease if they eat a lot of processed foods. Take India, for example. The country's rates of diabetes, heart disease, obesity, and stroke have increased far faster than might have been expected given its relatively small increase per capita of meat consumption. This has been blamed on the decrease in whole plant food content of their diet and an increased consumption of refined carbohydrates, packaged snacks, and fast food products. India's staple are lentils, fruits, vegetables, whole grains, nuts, and seeds. Dr. Greger says a dietary quality index has been developed, which reflects the percentage of calories people derive from nutrition-rich, unprocessed food on a scale of 1 to 100. The higher people score, the more body fat they lose over time, and the lower their risk may be of abdominal obesity, high blood pressure, high cholesterol, and high triglycerides. Comparing the diets of 100 women with breast cancer to 175 healthy women, researchers concluded that scoring higher on the whole plant food diet index, greater than about 30 compared to less than 18, may reduce the odds of breast cancer by more than 90%. Dr. Greger says, sadly, most Americans hardly make it past a score of 10. That's 10 out of 100. The standard American diet rates about 11 out of 100. According to estimates from the US Department of Agriculture, 32% of calories come from animal products and foods, 57% come from processed plant foods, and only about 11% comes from whole grains, beans, fruits, and vegetables, and nuts. Dr. Greger refers to research study entitled Death Row Nutrition, Curious Conclusions of Last Meals, which analyzed the last meal requests of hundreds of individuals executed in the US during a 5-year period. It turns out that the nutritional content didn't differ much from what Americans normally eat. Dr. Greger warns if the US population continues to eat as though they were having their last meals, eventually they will be. The American Heart Association has come up with the simple 7 factors that can lead to healthier life. First, not smoking. Second, not being overweight. Third, being very active, defined as equivalent to walking at least 22 minutes a day. 4, eating healthier, for example, lots of fruits and vegetables. 5, having below average cholesterol. 6, having normal blood pressure and having normal sugar levels. According to American Heart Association, of the 1,933 men and women surveyed, most met 2 or 3, but hardly any managed to meet all 7 simple health components. In fact, just a single individual out of over 2,000 boasted meeting all components. Thank you for your time. If you have any question, I will do my best. Thank you.
با تشکر از جناب آقای